Hello everyone, welcome back to our channel. Today I am going to share a very interesting and surprising case from our NICU. This is the story of a newborn baby who surprised the whole medical team because of his extraordinary birth weight. When the baby was received from the operation theater, everyone in the NICU was amazed to see his size and weight. The baby weighed 5.3 kilograms at birth, which is much larger than the average newborn baby. Normally, most babies are born with a weight between 2.5 kilograms and 3.5 kilograms. Any baby above 4 kilograms is considered a large baby or macrosomic baby. But in this case, the baby weighed 5.3 kilograms, which is extremely large for a newborn. Because of this unusual size, the doctors and nurses were surprised and immediately started careful observation and monitoring. This baby was delivered through cesarean section in the operation theater because the doctors already suspected that the baby might be larger than normal. Delivering such a big baby through normal delivery can sometimes be difficult and risky for both the mother and the baby. Therefore, the obstetric team decided that C-section delivery would be safer. After the baby was delivered, the pediatric team received the baby from the operation theater, OT, and immediately brought him to the NICU for initial assessment and monitoring. When the baby arrived in the NICU, the first step was to carefully check the baby's breathing, heart rate, and overall condition. Fortunately, the baby was breathing on his own and had a good cry, which is always a positive sign for newborns. However, because of the baby's very large size, the doctors needed to make sure that everything was completely stable. The baby was placed under the radiant warmer to maintain his body temperature. Maintaining proper body temperature is very important for newborn babies, especially immediately after birth. The nurses carefully dried the baby and made sure he was comfortable and warm. Next, the medical team measured the baby's weight, length, and head circumference. When the weight was checked on the scale, it showed 5.3 kilograms, which immediately surprised everyone in the room. Even experienced doctors who have delivered many babies do not often see newborns with such a high birth weight. Because the baby was so large, the doctors also considered the possibility that the baby might be an IDM baby, which means infant of diabetic mother. Sometimes mothers who have gestational diabetes or diabetes during pregnancy can deliver larger babies. These babies often require close monitoring after birth because they can develop certain conditions such as low blood sugar, hypoglycemia. Therefore, one of the first tests performed for the baby was blood sugar monitoring. A small blood sample was taken from the baby to check the glucose level. Monitoring blood sugar in large babies is very important because low sugar levels can cause symptoms like jitteriness, poor feeding, or lethargy. Fortunately, the initial blood sugar level of the baby was within the acceptable range, but the medical team continued to monitor it regularly during the first few hours after birth. Another important observation for large newborn babies is their breathing pattern. Sometimes large babies can develop breathing difficulties such as transient tachypnea of the newborn, TTN, or other respiratory conditions. The nurses carefully observed the baby's breathing rate and checked for any signs like grunting, chest retractions, or fast breathing. In this case, the baby was breathing comfortably, and there were no signs of respiratory distress. This was a very good sign, and it indicated that the baby was adapting well to life outside the womb. The baby's oxygen saturation level was also checked using a pulse oximeter. The oxygen levels were normal, which meant the baby was receiving enough oxygen through natural breathing. However, even though the baby appeared strong and healthy, the doctors still remained cautious. Large babies can sometimes develop complications such as low blood sugar, hypoglycemia, birth injuries due to large size, breathing difficulties, jaundice after birth. Because of these possible risks, the medical team continued regular monitoring. Over the next several hours, the baby remained stable and active. His breathing was normal, his blood sugar remained stable, and he showed good feeding behavior. These were all positive indicators that the baby was doing well. The doctors also informed the baby's family about the situation. The parents were very happy and surprised to learn that their baby weighed 5.3 kilograms. For many families, such a large baby becomes a memorable and special event. The mother was also monitored carefully after the cesarean delivery. Delivering a very large baby can sometimes be physically challenging for the mother, but fortunately the surgery was successful and the mother was stable. As time passed, the baby continued to show good progress in the NICU. The medical team was satisfied with his condition and continued routine newborn care. Cases like this are always fascinating because they remind us how unique every newborn baby can be. While most babies are born within the average weight range, occasionally we see exceptional cases like this 5.3 kilograms newborn, which surprise even experienced doctors. Such cases also highlight the importance of proper prenatal care and hospital delivery, where trained medical teams can safely manage both the mother and the baby. In conclusion, this was a very interesting case of a giant newborn baby weighing 5.3 kilograms, received from the operation theater and monitored in the NICU. Fortunately, the baby was stable, breathing well, feeding properly, and adapting normally after birth. The entire medical team was surprised but also happy to see that such a large baby was doing well.